I'm Dr. Chris Gehrlein, and I'm the Medical Director for Mother Teresa Hospice. So I've been involved in hospice care now for about 13 years. I think one of the most misunderstood parts of hospice centers around when to get hospice involved in someone's care. And a lot of people think that it's something that's just at the very end of life to bring in. But honestly, the best time to get hospice care involved is when someone has an end-of-life illness and knows that they don't want aggressive treatment, know that they want just comfort care. And so that may be weeks, that may be months before end of life. And the earlier you can really get hospice involved, the better care and the better quality of life they can have at the end of life. And I always tell people that, especially families, that hospice is a gift. I feel like being able to give somebody the gift of hospice is one of the greatest gifts that you can give someone, and to provide end of life, good quality of life at the end of life and comfort care is a tremendous gift. So I became involved with Mother Teresa Hospice 13 years ago, just a couple years after I got out of residency, and I had been doing geriatrics as my main focus, and so I became familiar with hospice over the first couple years of my career. And fortunately, I was given the opportunity to become the medical director for Mother Teresa Hospice, and it was a great opportunity because they were small, family-owned, close-knit hospice, faith-based as well. Faith for me is the most important thing in my life, and that's really the center of Mother Teresa Hospice. And as I've found over the years in continuing to grow with this hospice, is that it's confirmed everything I thought initially, was that it's a very close-knit group. We provide a lot of spiritual resources and assistance to patients and families, and it's just a great environment to work in, and the people who work there share common beliefs to mine, which is great. So my role as medical director for all of the hospice patients that are within our service, I have my own patients who I continue to follow directly that are under the hospice care. But then even the other patients who I may not be their primary care physician, I'm still involved in their care. They'll still see their primary physician, but I'm also in constant contact with our nurses, our aides, our social workers, our chaplain, to really provide the best quality care for them as possible and the best comfort. And we sit down and discuss every patient and what would be best for them. And I may have a suggestion that maybe their physician didn't think of, and we can go to their physician and suggest it, and vice versa. I might get suggestions from our team, and then we can take it to their physician as well. So I'm involved with every patient on our service.